So what are the stages of varicose veins? Now, we generally clinically use a classification known as the CAP classification, which is divided into clinical, etiology, anatomy, and pathophysiology in terms of where they actually start and where they end. But to give you a rough idea, the lowest denominator would be there's nothing that you can see clinically on your legs and you can't even feel anything on the leg, to finally having an ulcer on your leg being the worst class. Now, for most people who have spider veins and some varicose veins, most of them will sit between the first two areas of the CAP classification, and then it worsens. And this is the progression of venous disorders, whereby it chronically gets worse over time. And the worsening kind of starts with swelling, and then you may have skin changes, and then, as I said, you will end up finishing it off with an ulcer. And somewhere in between, if you've had an ulcer before, you have signs that you've had an ulcer but it's healed, you would still sit at the latter end. So generally speaking, when you do have varicose veins, you want to address them before you get into any of the other stages where it's complicated, whereby you have skin changes, you have pigmentation, you have some areas that are red and tender, and potentially bleeding, ulcers, and even a healed ulcer. So the main purpose of this video is to say that when it comes to the stages of having varicose veins, most patients are concerned about, could this get worse or is it dangerous? Now, it's hard to tell how quickly it is going to worsen, and with one study that was done before, it showed that in 10 years it almost doubled or worsened in that period of time. So no matter where you started off, whether it was just spider veins, in 10 years you're pretty sure it's going to get worse, and that's with most things generally speaking. But this sort of gives you an idea in terms of the stages of where most people are and where we don't want them to get to.